Okay, so these are postpartum instructions. You should check your temperature and the baby's temperature every 6 hours. Yours shouldn't be greater than 100.4 and the baby should be between 96.8 and 99. Oftentimes the baby just gets wrapped too much in too many layers and overheats that way, and you can just take a layer or two off or take the blanket off or whatnot and retake their temperature in about 20 minutes and it'll regulate. Just keep in mind that the baby can't regulate his or her own temperature, so you want to keep the room warm or just keep the baby close to you and bundled up. Let's see, just your own temperature is a good gauge. If you're in shorts and a t-shirt and it's very warm outside, then the baby should be fine with just a light blanket. Bleeding, you aren't going to want to soak more than two pads in 1 hour. You might pass some clots, and it's normal if they're golf ball size. Anything that is larger, like the size of an orange, you're going to want to call. Let's see, massage your uterus as often as you think of it. It's just going to help it to get back to its normal size. Like every time you drink water, every time you use the toilet, just as often as you can. If you are finding that you're feeling very dizzy when you stand up or faint at all, give us a call. If your discharge is foul smelling in any way, give us a call, as that could be a sign of infection. When you guys get home from the birth center or after I leave, if this is a home birth, you will probably all have a nice long nap together. After you sleep and the baby sleeps, maybe 5 hours or something like that, you should begin to nurse the baby at least every 3 hours for 15 to 20 minutes each time. It's really helping with all of that good colostrum, getting that into the baby. And your milk will come in within 3 days, typically. And when it does, you should just nurse the baby as frequently as the baby wants. So you can just watch for cues like rooting and signs of hunger like that. It shouldn't hurt when you latch the baby. If it hurts, then you need to just put your finger in there and break the latch and start again. If you do have sore nipples the first few days, you can put lanolin on them. Give us a call if you have any issues at all, any questions at all. And La Leche League is also a really great resource. And the paper I'm about to give you has that information as well. The cord, you're going to want to keep it dry. Watch for redness and discharge because that would be signs of infection. The first day, the baby should have 1 wet diaper, the second day 2, and by the time your milk comes in, probably about 6 a day. You can put a little bit of coconut oil or olive oil in the diaper these first couple days just to help with that meconium that's going to be coming out. It's very sticky, and so that'll help keep it from adhering to the skin. Let's see, jaundice, you can watch for that. It's caused by the baby's excess red blood cells breaking down. And a lot of times people will see yellowish eyes and think that that's jaundice, but that is usually just capillaries that have ruptured during birth. Jaundice that is concerning is more often below the nipple line. So give us a call if you notice that at all. One thing that does help to prevent jaundice is to just let the baby get indirect sunlight. So like if it's a sunny day, just lay the baby in nothing but a diaper in the window to soak up that sun. That'll help. we're leaving you with a little squirt bottle, and you can fill that with warm water, and whenever you urinate, just rinse with that. Don't wipe, just pat dry. If you made any pads with witch hazel or aloe, those are great to just soak and then put in the freezer. And you can just wear those to help with pain. You can also get a little sitz tub at a pharmacy and make a tea infusion of calendula and comfrey and soak in that for about 10 minutes at a time. That'll help with healing. You want to drink plenty of fluids for breastfeeding. Just drink as much water as you can. Be careful with like high acidic, like orange juice, strawberries, things like that. Other foods you're going to want to avoid are like brassicas, so broccoli, onion, garlic can create problems for the baby's digestion. And you want to eat a lot of foods that are high in fiber. So like dark leafy greens. Keep taking your prenatal vitamins. Try and rest. If you do have stitches, you're going to want to keep your legs together as much as possible. And remember the placenta that I showed you, that's the size wound that you have inside of your uterus. So even though you can't see it, you really need to just give your body some rest and take it easy and let that heal. So stay in bed as much as you can. Take advantage of people that are helping you, bringing you food. Just enjoy your baby. Sleep when he or she sleeps. Get all the rest that you can. And we'll be back tomorrow for a 1-day visit. And then again, 3-day, 5-day, 1 week. And then you'll come into the office at the 2-week mark. And then we'll have our final visit at 6 weeks. So when we return on day 3, we'll take care of the birth certificate stuff and do the fun little footprints. And when we come back for the 1-day visit tomorrow, we can do the first PKU test. And the test that checks for cardiac defects. So get lots of rest. You guys did a great job. Write down your questions and we'll see you tomorrow.